Good afternoon, everyone. Well, we are very lucky because it's hard to think of two people who can speak from a more interesting perch about the subject of global health than the two I've got to share the stage with this afternoon. It's also hard to think of a more timely moment to have a conversation about global health, because while I'm sure there's never a dull moment in your field, we're getting to talk at an especially dramatic one. And the moment is this. At the United Nations just this week, they signed off on a report card of sorts called the Millennium Development Goals, which is a culmination of a huge effort, 15 years, trying to measure what we're getting right and what we're getting not so right in the field of global health. So Vanessa, I'm going to turn to you first to take this on and get your take on this report card. It seems to have been a very mixed bag. I mean, on the good side, on the A side, deaths from malaria down sharply, maternal mortality rate down sharply in many countries. The number of people who have access to safe drinking water is up. On the less good side, still hundreds of millions who don't have access to clean water. Still a horrifying number of women dying in childbirth around the world. One of the bluntest images you can be left with, at least 1 billion of our fellow humans going to bed hungry every night. What's your take? I mean, it sounds like the world didn't flunk over the last 15 years. We're certainly not getting straight A's either.
So, first of all, thank you for letting me join you today and all of you. And I'm certainly, I just need to say, incredibly humbled to be sharing a couch with Dr. Fauci, who has been an icon in this field for years. And so this is a really extraordinary moment for me. And I'm also humbled to have to answer this question first when I have Dr. Fauci sitting here.
You wouldn't want to have to follow him.
That's charge. I don't know. Maybe I could, spin off it. But it's interesting. I personally feel the Millennium Development Goals were a really important marker. If you look at global health just in the last decade in general, there's a number of, 15 years, extraordinary things that happened. One was PEPFAR went forth and really changed our definitions of what we could do in public health. And I think the Millennium Development Goals were certainly a part of that as well, because it set an idea that we can do something, we should do something, and more than that, we're actually going to challenge ourselves to do something. And so I think overall the takeaway has been that they were very good. I think actually quantifying where maybe we have fallen short of where we wanted to go was also important, because I think it continues to spur people to do more, do better, and to think about the innovations that we're missing, or where to continue to analyze where the opportunities are and to try to make a mark in them. I think part of it too comes down to just the real truth of the fact that the work is hard. Yeah. We maybe need to understand it takes longer to achieve some of these goals than we otherwise would like to accept. And I think that we need to put resources in it. And I think that's the ultimate challenge to everything that we do, is that it's going to take a tremendous amount of resources to tackle these major problems. And it's going to take resources the cost of not putting them forth, I think, is much greater. And I'm going to pass the baton for a moment to Dr. Fauci, because he's had the experience, I think, of seeing really incredible swath of history in global health to speak to this with a lot of experience.
Is it useful, though, to follow on the comment Vanessa just made, is it even useful to have the same set of health goals apply everywhere? Sub-Saharan Africa, Sweden?
Right. Yes and no. Obviously, if you just make it totally uniform, there's going to be much more relevant in one particular area of the world than the other. But the point that Vanessa made, I think, is really critical to any time you put out goals and targets. Goals are good, but you really need to back them up with the resources, because to just set a goal when you know a goal is attainable and yet the resources are not there. Now, a goal can be helpful to get people mobilized, organizations mobilized, to be able to meet the goal and meet the target. But as we were talking before, the thing that stands out as an example is that right now we have what it takes, if we really put the resources in, to essentially put an end to the AIDS epidemic, merely by implementing the advances we already have. There are still scientific challenges. We still need a vaccine. We still need a cure. But
When you say we have what it takes, what do we have?
Well, when you have a goal, the objection is that people say, well, what's the scientific evidence that says if you do this, you will get to this point? And sometimes the scientific evidence is soft. When it comes to HIV, the scientific evidence is incontrovertible, and that is that if you identify and treat people who are HIV infected and bring the level of virus in their body to below detectable level, it will be almost impossible, not impossible, but almost impossible for them to transmit the infection to somebody else. So it becomes an implementation challenge. Now, years ago, when we didn't have terrific drugs that could do that, well, then you could argue, well, what's the benefit of putting so much resources to identify the people to get them in care? Now we know we can do it. And the other thing is we know that, for example, for people at high risk, if you give them pre-exposure prophylaxis, you can prevent infection. And for every infection that you prevent, you save anywhere from $300,000 to $400,000. So the amount of money that it would cost to implement is dwarfed by the amount of money you would save.
All right, let me stop you there. So what you're saying is we have the medical know-how to eradicate AIDS.
Not eradicate, but to make it no longer an epidemic, to bring it to the point where it's really very, very much low level.
What is the obstacle? Money?
The obstacle is resources, as well as things that overlap, as Vanessa was saying, overlap with other global health problems, is the lack of a healthcare infrastructure to implement. So the two obstacles to implementing is A, the resources to put it in to implement it, and the other is to have the healthcare infrastructure, which is the reason why the President's Emergency Plan for AIDS Relief, the PEPFAR program, is very focused on not only just treating or preventing, but actually building a sustainable infrastructure in these countries.
You have spoken recently, and I'll stay with HIV and AIDS for a minute. You've spoken recently about that you hope to see a vaccine within our lifetimes that would eradicate it.
Right.
Where are we in that effort?
Well, the research has been quite encouraging over the last 10 years. HIV is one of the most perplexing of all viral infections we've ever had to deal with because for reasons that are very complicated, the body does not make naturally a good immune response against HIV, which is the reason why, as stunning as this is, there hasn't been a single documented case of someone who's been infected and actually spontaneously cleared the virus, the way so many people do with even deadly diseases like smallpox and measles and polio and other diseases. The immune system is not particularly capable of doing that. So the scientists have to do even better than what natural infection does. So it's a big scientific challenge as opposed to an implementation challenge.
But what gives you hope that we're going to achieve that?
Well, what we're seeing
in
right
the coming
now is that we're
generation?
really getting into the dissecting of what it takes and how you present a particular immunogen, we call it, which is the kind of protein that's in a vaccine, how you present it to the body to be able to make this very difficult response to make. And I would say in the last 4 or 5 years, there's been a quantum leap in our ability to do that.
Vanessa, I mean, we're talking about some of the obstacle. I suppose, it's the challenge in any field, whether global health or anything else, resources, money, how you allocate the resources. There's also, when you look at something like AIDS, malaria, other diseases, there's the opportunity cost of not doing something. How do you weigh that in your field?
I mean, the opportunity cost of not, I think and I apologize, we had a very robust conversation before we came out, so we're going to keep referencing this conversation, but we had talked a little bit about the, understanding the opportunity cost of not doing something, and it's very hard to quantify because a lot of it ends up in sort of mathematical modeling and, retrospective analysis of what it has cost in the past when we haven't done things. But health is evolving, problems, within global health are evolving, and I think that we do have some fundamental lessons now that we can take forward. And if you look at HIV, and Dr. Fauci just mentioned that PEPFAR is very focused on building robust infrastructures. In fact, Seed Global Health, the organization I run, we send doctors and nurses abroad to teach, train, and build a new generation of highly skilled local doctors and nurses in the places we work. We're funded by PEPFAR. With that idea that you need trained healthcare workers in order to be able to understand how to administer drugs, to deal with the ramification, when folks live longer with HIV, they live long enough to get heart disease, and they live long enough to get diabetes, and they live long enough to have complications or to need to be on a different regimen. And you need smart people who can help manage that process. And so, but that's a lesson that we've learned over time, for example. And I think Ebola is another, as you transition, when you look at what's happened in Ebola happened in West Africa at the size, scope, scale, and speed it happened. Well, part of the speed is just inherent in the disease itself, but because there was not strong health systems there. There were not skilled health professionals to identify the disease, to know what to do. We talked about Nigeria, where you had 8 cases because they very quickly identified the disease and they had the protocols and the systems and the resources in place to shut it down. But we sort of know that you had to go to the root of the problem in Ebola. We know that Ebola got as bad as it got so quickly, and it manifests itself in West Africa the way it did because there wasn't a strong health system. But those are lessons we've taken from before, too. And I think we can take those lessons forward in general preparedness and say, all right, we know it might not be Ebola, but it might be something else. There's another epidemic waiting to happen, or there's another disease that is going to come and take off and become a problem. We know we have some basic principles about how to deal with those already now, but we need to be making those investments. And the investments we need to make are going to take time, energy, and then back to the key theme, resources.
If you follow that argument to its logical conclusion, Ebola erupted in West Africa because they didn't have the infrastructure that the West would to deal with it. The whole scare, anybody who was in the U.S. last summer who tried to take a plane anywhere, who tried to do anything, I was having business meetings canceled because people were scared of Ebola risk. Was that for nothing?
That was a distraction. That was
How so?
It was a
Explain.
distraction because what happened is that just exactly like Vanessa said, Ebola broke out the way it did in West Africa. Of course, West Africa did not even have a modicum of the healthcare infrastructure to be able to identify, isolate, contact trace, and stop. In the United States, you don't really want to be overconfident, but you can say with a considerable degree of confidence that given our healthcare structure, there would never be an outbreak of Ebola. There certainly could be an individual case the way there was when Mr. Duncan came and landed in Dallas, that if you have global travel the way you do, there will be cases of diseases that will come into the country. But Ebola thrives on a dysfunctional healthcare system. And since we have a healthcare system that has problems, but it's far from dysfunctional, it just wasn't going to happen in the United States. And that's when I say a distraction. You're right. People were afraid of getting on an airplane in San Francisco because there was a nurse in Dallas who went to Cleveland. What is that all about? So it really was quite a misplaced risk assessment.
And you just look at the 2 nurses who got sick. They did quite well. They got early treatment, early identification, and they were put in a system, and they were tweeting pictures of themselves on cell phones. I'm not belittling the experience they went through. Terrifying for them, terrifying for the family. But I think we also need to be armed with the information and be realistic. And I think that it was the fact that they did do so well, I think, is an indication of our healthcare system's ability to also just treat the disease.
Well, so what's the takeaway for the two of you from the Ebola episode, which as you well know, is ongoing in parts of West Africa, 11,000 dead at this date. Has that been a game changer in your field in global health in the way that, say, 9/11 was in the national security world?
I wouldn't say it's a game changer because we knew about this by multiple other examples, the possibility of a pandemic flu, the possibility of MERS going from the Middle East to the United States, the SARS scare. And what it really tells us, and Ebola was a truly dramatic example of that, is that we need the kind of network globally. It's now being referred to as the Global Health Security Network, where you have contributions from countries throughout the world to identify and network with each other with the proper diagnostics. So when an outbreak occurs, you don't respond to it 3 months later. Remember, the first child that was infected with Ebola in Guinea was infected in December of 2013. It wasn't until March of 2014 that the world realizes that there was an Ebola problem in West Africa. That was completely unacceptable that happened that way.
And is the hope that if you get this network, this infrastructure in place, then whether it's Ebola or SARS or something horrendous we haven't even conceived of yet, that same infrastructure could help address, shut it down, contain it.
Totally. Yes.
I think that's exactly, but I also think we have to be realistic about going to the root of the problems again. And, I say this biasly because this is the work that we do, but I think that we have to accept that just having that network isn't the safeguard for all of us. We still have to fix some of the fundamental problems, in these places to ensure that diseases are treated early and identified. And Ebola is important and it's a serious one, but we still have a great challenge of HIV.
Right.
The World Health Organization just issued its recommendations that absolutely every single person with HIV should be on treatment. We still are countering huge amounts of malaria, huge amounts of TB. Cardiovascular disease is now the #1 cause of death globally. Malignancies. I mean, we're facing a number of health challenges that are going to affect us all globally just by the nature of travel, the nature of global business changing. I mean, borders don't matter the way they used to anymore. And so problems in other countries are actually our problems too.
Right. And within countries, there's disproportionate attention to things. Facts that stun people that are true. During that period of over a year in West Africa, when you had the deaths you were spoken about, more children died of malaria and measles than died of Ebola.
Right.
Because of the healthcare system, which was dysfunctional to begin with, completely collapsed during the Ebola outbreak because people were understandably afraid to bring their children to the hospital. Vaccinations were interrupted, so measles broke out in a much more robust way than it would have. So all of these things are connected in a way, and I think Ebola just focused on the weaknesses in our system, which are going to take a lot of time and a lot of effort and a lot of resources to
It captures
address.
headlines and takes resources and
Right.
attention away from everything else. Let me move us toward a finish by asking you a question that I have often asked national security officials because it sometimes leads to a candid answer, which is what keeps you awake at night? Question in your field.
Well, in my field as an infectious disease person, what keeps me awake at night is the emergence, because new infections emerge. We know that. There is a global history throughout the decades and centuries of outbreaks of things like influenza pandemics. So what makes me concerned is an outbreak of a easily transmittable respiratory infection that has a high degree of lethality. I mean, we had
respiratory, airborne, so
exactly.
Easy,
I mean, that's the way it was spread, and that's the thing that really worries me.
Agree?
It's not my two children. It is definitely, I think for me, actually, it's the two standards of care that exist in the world. It really is painful to go to these places and to work and to see that that is still acceptable in 2015, that we still, as a global community, tolerate letting people live the way they live, being on wards with mattresses where they're on the floor, they have no blankets, they have no food, they can't get testing, they can't get drugs, where they go to hospitals, basically it's a place to die because they don't think it's a place they can treat. It's really abhorrent to me. And it's just, I think, a painful reality that we need to all be working against.
Well, and this is, I'll close by saying that at the UN this week, they also announced an ambitious set of new goals, 17 new goals, taking us from now to 2030 and addressing root causes of a lot of the things we've been talking about. So we hope we get to rejoin you in 15 years. We'll check in on where things are. Anthony and Vanessa, thank you so much.
Thank you.
Right on that.